Hi, this is Dr. Mark Sehl for the YouTube channel Therapy for the Heart, and it's Wednesday, so I'm a little late for Tuesdays with Mark. I wanted to talk about something that's very relevant to me, and I think many of you, but something that we might not want to hear, particularly if we're therapists. So it's about racial and class discrimination among psychotherapists. That's the topic for today. And it's a difficult talk because it's addressing myself, other therapists, and their willingness to really be working with a large population in their practice rather than narrowing it down based on prejudice. So a woman named Heather Kugelmass, she studied the prevalence of racial and class discrimination, and her title of the paper was "Sorry, I'm Not Accepting New Patients: An Audited Study of Access and Mental Health Care" in the Journal of Health and Social Behavior, 2016. So we're not talking about, half a generation ago. We're talking about 2016, not far away. So in that study, a group of 320 psychotherapists was used to conduct this study, and a number of actors would leave a voicemail on the therapist's machines requesting an appointment. Now these actors also, in order to differentiate between white, black, middle class, lower class, they would use a typical name for a black male or female, and also they would alter their grammar to portray somebody who was maybe lower middle class versus upper middle class. So it was pretty effective in terms of her study. I mean, she didn't find that was a difficult thing to do in terms of getting her study together. So they measured the responses of the therapists to the query around wanting psychotherapy. So each therapist, they were highly educated and under scrutinized, which this population of therapists, I'm not sure how well they've been scrutinized in terms of this kind of research, but highly educated. And each therapist received a voice message from one black middle class and one white middle class help seeker, or from one black working class and one white working class help seeker, all requesting an appointment. So, some of the conclusions. In middle class help seekers, blacks less likely than whites to be offered an appointment. Lower working class individuals and African Americans were at a disadvantage, even controlling for insurance coverage. Only one preferred appointment was offered to a working class black male, out of 80 therapists to whom he reached out. Only one appointment was offered to a working class black male out of 80 therapists to whom he reached out. The best appointments were given to weekday evening appointments were given to white middle class women. Black and working class help seekers had approximately 1/5 the odds of being offered an appointment at any day or time relative to the white middle class help seekers. So in conclusion, an already vulnerable group, meaning those people who are seeking treatment for mental health services, they're already vulnerable, black and working class. So those people were discriminated against based on race, class, or gender. That's pretty alarming statistics. As I said, this 2016 was done. So another study I came across was led by Dr. Marist covering 50 states, and the co-authors were Dr. Steffi Woodhandler and David Himmelstein. So they found that minorities received less of virtually all types of mental health services. Minorities received less of virtually all types of mental health care. That was published in the International Journal of Health Sciences, also 2016. They found that Hispanic youth got only half as much mental health care as whites. Whites received about 3 times more outpatient mental health services than blacks and Hispanics in this age group. So whites received about 3 times more outpatient mental health services than blacks and Hispanics in this age group. The substance abuse counseling rate for black young adults was strikingly low, about 1/7 that for whites. To quote Dr. Woolhandler, minority kids don't get help when they're in trouble. Instead, they get expelled or jailed. But punishing people for mental illness or addiction is both inhumane and ineffective. The lack of care for minority groups is the real crime. So unsettling it is. So what can we do about it? Except jarring my camera here. What we can do about it, we can think a lot about it and how to correct it. And I think the first thing that comes to my mind is education and being open about education in the schools of social work, schools of psychology, mental health counseling, where that is offered in whatever institutions or schools. They need to be really conscious of this and open to what they're going to hear, because that's the hardest part. And also another hard part is being students and professionals being open to be willing to share what their inner thoughts and feelings are. I did a social work class, master's in social work, about addiction. And what I found was very interesting. The class was mostly theoretical in the beginning. It was about harm reduction treatment of addictions. And so somewhere in the class, I asked the question, by the way, who would be willing to talk about their attitudes towards people who are substance users? And people were very reluctant. No one wanted to speak up at first. And so it only takes one person to say something in a class if you're open to eliciting it. And I think generally people have been pretty trusting of me in terms of being able to tell things to me. So they did open up, and they had all their negative attitudes came out about people who are addicted. You know, they're lazy, selfish, self-interested, take advantage of other people. They're criminals, a lot of violence. You know, these are all stereotypes, most of which are not true of people who are addicted in general. They're true of some people, but that's true of some people in the population. But it was very relieving, I think, for them to be honest with each other about how they felt about working with, how they would feel or did feel about working with people who were addicted. It was refreshing. It was like honesty there out in the breath of fresh air in the class. Right? And you see, when in my practice, I run a training group, psychotherapy training group, and I was taught how to do this through very beloved modern analyst, Dr. Jerry Lucas. But what we did on Saturdays, we would go to his class, and one of the tasks was to say everything that was on our mind without hesitation, as humanly possible. And that's not easily done, right? But and I developed I imitated his class when I got older, and it was wonderful. It was wonderful. People who could speak openly would be in the position of helping their patients speak openly. If they could not speak openly, they wouldn't be able to help their patients do the same. That was the whole basis of this group that I ran, and I do run continuously every year. Because what we can't say openly, we can't help our patients say. And the group is very supportive. There's no judgment. One person left the group for 2 weeks because she was afraid to come in and talk about her sexual feelings about her male patient. Well, we all have feelings about all different kinds of feelings towards our patients. And it's only our inhibitions that are going to limit us in terms of how expansive we can be within ourselves and help others be the same. So that group has continued now for 7 years. And that kind of education, I think, won't fly in some institutions, and some will. But the basis of it was to open people up to their real experiences within themselves, feelings, thoughts, so that they can eliminate prejudice based on race, based on class. How else are we going to do it? We have to open up the discussion to people, different people, and into the society. Jim Crow is right behind us. It's not going away. Viola Davis, I like what she said in her talk. She said that she was really tired. She's a very dark-skinned black woman, and she said she was very tired of people only being attracted to someone whose complexion is not darker than a brown paper bag. That's amazing, it's like, but this is Jim Crow. People were, this is a history. If you ever saw that program, the 13th, it just illustrates the history of Black Americans and how from the beginnings until very recently, and the ending is very, very surprising and disturbing about how much prejudice exists in big corporations, et cetera, et cetera, et cetera. So we have to look into ourselves, and that should not be an easy task, because it isn't. It's hard to say. Who wants to say in a group that they have prejudice based on race, color, whatever? You're not supposed to think that way. You're not supposed to feel that way. And most therapists are in a bind because they like to project themselves as not having these kind of feelings. You're not supposed to have those feelings if you're a therapist. And that's the difficult task of being a therapist, in my mind, is because there's so many impositions and prohibitions that we're supposed to be a certain way, some ideal image which can never be, and it's not human. But that's the difficulty of being a therapist, I think, is to be able to be oneself and free and still function and to help people. Well, the main thing in helping people is to do no harm. As long as we don't behave in a prejudiced way, in terms of the study that illustrates that certain people were chosen over others because of race or color or gender. So I just welcome you to make a comment on this talk, what your experiences have been. You're invited to use a Gmail account, and you can make a comment on this channel. Just have a Gmail account, and you don't have to reveal your identity, of course. Unless your identity is already automatically revealed in your Gmail account. So I invite you to make a comment just in general. You don't have to comment about yourself, basically, but maybe what you've experienced in the field, what you've seen others, because it doesn't have to be personal about you, but what your experience has been. You've worked in the field of social work, psychology, counseling for years, some of you, some of them are just new, and it would be interesting to see what new people's experience is about working in a mental health clinic or a training program, and how that training program is responsive to these kinds of issues, and to talk about them openly. Okay, so I hope there's a little place where you can either like this talk or don't like it. So I wish you would, because this is an important subject, not that the other ones aren't, but this is a very important one. I'd like to get some feedback from you in terms of your reactions. So this is Dr. Mark Sehl, And signing off for YouTube channel Therapy for the Heart. Robocall. I want to get a robocall debugger. I think they're out now. Verizon's pretty good. It says spam. Yeah, so nice to be here again. And I'll catch up next time, perhaps a talk coming off this talk. All right. Bye-bye for now.